Today we have the pleasure of meeting Doctor of Physical Therapy Nicole Hogan. She is a physical therapist at Children's Mercy Sports Medicine here in Kansas City. How are you doing today, Nicole?
I'm doing well.
Good.
How
Hey,
are you?
I'm glad that you're able to come on and talk with our students a little bit more about physical therapy. You know, every physical therapist has their own why they got into physical therapy, and we'll get to that a little bit. First, I want to talk about your schooling. So you went to Washburn University in Topeka, Kansas, to start. And how did that school attract you?
So I actually, going into college, I didn't really know, hey, I want to be a physical therapist, like by the time that I'm done. So going into college, I played softball. And so that's kind of what ended up taking me to Washburn, really, was kind of the athletics side of things. I love the class sizes. It just kind of felt like the right fit when we ended up, going on the visit.
Right.
And so then that's kind of how I started, I guess, my journey. And then as you go through college, you try to figure out, as far as majors, what you want, what classes you want to take besides your gen eds. And so initially, I didn't really know that they had the physical therapist assistant program.
Okay.
And so initially, I started out kind of the business track. I knew I loved talking to people. I knew I loved kind of the personal nature of just like being involved. And so I kind of went kind of the business marketing route, thinking, okay, I'm gonna, this will be great. I can kind of get involved here. And then as it neared my junior year, where they really start making you kind of declare what that major is going to be, that's when I started to do a little bit more diving into the physical therapist assistant and finding out that they had that program.
Okay, good. So you ended up with a marketing management and a physical therapy assistant from there?
Yes, yep.
Okay. So once you got that degree, finished at Washburn, did you have any other work experience, or did you go straight into Wichita State? How did that kind of transition apply there?
So as I was in the PTA program, I was extremely involved as a student. So you have your professional organization, which is, you have your American Physical Therapy Association, and then you have your state chapters. So like there's the Kansas Physical Therapy Association, and I was kind of the president of our class at Washburn, and then I was really involved as a student kind of they have some student SIGs and boards. And kind of going through that process, I went to a lot of conferences as a student that they hold for students throughout my time as a PTA. And at that point, I just had met a lot of other PTs, and I got even more exposed to kind of the profession and what we do, as far as, PTs and PTAs. And then that kind of sparked my further interest then to go to physical therapy school after becoming a PTA. And
Right.
so once I finished with my PTA degree, the unfortunate part, so actually going into PT school, you just have to have a bachelor's degree.
Okay.
You don't have to have, and it can be in anything. So there were people in my physical therapy class that had psychology degrees. One I think was actually a theater major that was going back to school. And so you just have to have that bachelor's degree in anything. And but the only unfortunate part with that is I didn't have like chemistry, some of those prerequisite courses that were required to apply to PT school. And so then I had to actually go back and take all of those. So I worked PRN as a physical therapist assistant, and then I actually worked part-time in Washburn's athletic department as kind of a marketing assistant director to their person at the time. And so I kind of used both of my degrees when I initially started. And then in the meantime, I was taking those classes. So I had to take Chem 1, Chem 2 physics, 1 and 2 microbiology. There were some extra courses that I need. So I took those classes kind of on the side. And I went ahead and applied to PT school because through one of a conference that I attended, I had met a woman. Her name was Ellen Spake, and she was the director of Rockhurst University's program at the time. And she told me that I could go ahead and apply, even though I was still taking those courses. But I just, in my mind, was like, I'm never going to get in. I have to take all of these courses. And I ended up applying. I ended up getting accepted. And so then I ended up finishing all those courses within that year. And then that following summer in June started PT school.
Okay. And that was through Wichita State?
And I was through Wichita State. Yep.
How did you choose Wichita State versus maybe KU or some of the other local area ones?
Yeah, after doing a lot of research just on the different programs, I obviously loved Rockhurst because that was also where, again, Ellen, she was kind of from. And after doing a lot of research, for me, it came down to kind of finances. And so how much student loans was I going to have to take out? As far as paying that back then after college. And then looking at the different curriculums to each school, as far as the differences, like were there really that many differences in, curriculums from KU to University of St. Mary to Rockhurst to, I applied to University of Nebraska in Omaha. And so, just what were the differences? And when you really look at a lot of the curriculums, they're really about the same. So some they're different in regards to their structure. So like some schools will have you take like anatomy in the summer versus the fall. But as far as like the meat and potatoes of like what the courses they're offering, most of them were about the same. You would occasionally have like a one-off class that was a little bit different. And so in regards to kind of the finances and then kind of as far as curriculum, that was kind of what was my biggest decision. And then kind of each school, it's kind of like when you go to undergrad, and you take tours of different universities, each school just kind of has different emphasis, I feel like, and different personalities. And you can kind of tell when you're on campus, kind of what that's like. And so just after, interviewing and kind of meeting people from different universities, that was also just kind of another deciding factor was where I felt like I'd best fit in.
Yeah, that makes a lot of sense. So after you graduated from Wichita State, what was your first job experience, or how long did it take you till you applying for different jobs or looking to land your first job out of school?
Yeah, I was really fortunate. So my very last clinical rotation was out in Colorado Springs, and it was at the center, and they are the official providers for the Olympic Training Center. And so that was where my last 12 weeks was.
Right.
And kind of through that process, kind of expect probably more towards the end, the discussion started about kind of hiring me, wanting to keep me on. And they just that experience had been just a great experience. And we just, I think they enjoyed having me as much as I enjoyed being there. And a lot of times in school, they'll even say clinicals are kind of, job interviews, for the period of time that you're on. And so after that, I ended up accepting that position to stay out there. And so I worked there for my first full year kind of out of school. And then at the time, unfortunately, my fiance at the time lived back kind of in Kansas.
Yeah.
And so he kind of tried to look for positions and things, nothing just kind of ever worked out. And so then that's kind of when we were in the process of getting married. And so I said, well, we probably should be in the same state, when that happens. And so then I kind of started looking back in Kansas. And so that was kind of that transition.
And then from that, then you moved into your position now at Children's?
I did. So being involved as a student, I was extremely, as I kind of already mentioned, in PTA school, I was also really involved as a physical therapist student. And as I was making kind of the transition back, I had reached out to some colleagues and people that were kind of in the Kansas Physical Therapy Association. And, you always think of like applying for jobs. In this situation, it was really unique. I mean, I kind of had people reaching out to me at that point because of the assistance from the KPTA and those individuals. And so through kind of that process, Children's Mercy was one that I ended up we ended up connecting, and then they were actually in the process of, Children's has grown so much in their sports department over the past, I'd say 5 to 7 years. And now we have a really nice facility out, kind of a partnership with Sporting Kansas City, which you probably have heard Michael talk about if you watched his. But in that process, they were in the process of kind of getting that up off the ground and running. So kind of having my background from Colorado Springs and kind of that experience with the USOC to then kind of coming back was really helpful and kind of valuable. I think of a valuable partnership there, and trying to help do that. So yeah, then I ended up at Children's, and I've been there ever since.
Awesome. So let's talk a little bit. You touched on in your clinicals being a kind of a job interview while you're doing your rotations. How long did you say the clinicals lasted, and how many of those do you do as a doctoral student?
So in your first year, a lot of times you'll do, and this is, has specifically how Wichita State was set up, but right. In your first year, you'll do some observations, and you do a variety of settings. They won't, they'll have you in home health, they'll have you in outpatient, inpatient, because they want you to get a feel for all the different services that kind of physical therapy can provide. And then when you go, as you keep going through that, then as you go through that year, you start out with a couple 4-week rotations. So they're smaller in length. And then as we go into kind of that second and third year, then you start some longer rotations. So you'll start kind of some 6 or 8 week rotations a lot of times with universities, and then a lot of times those last 3. So my very last year was primarily, we had a little bit of academic work on the side, but primarily clinical rotations, and I had 3 different 12-week rotations throughout that last year.
So what are some, on those 3-week or 3-month rotations, what are some things that they're looking for and you're looking for as a student to get out of that experience?
Yeah, I mean, as a student, and you're kind of like getting your feet wet in different locations, the first few weeks is really about just, I think, kind of getting a lay of the land in a sense of what each clinic is like, how they run, how they function, documentation, all kind of the necessities of what you need to know. But as a student, I took that as, this is your time to learn. Like, this is the one time in your life where you're going to have other clinicians at your disposal that you can ask a million questions to. You can pick their brains. You can, they are there for you. And so I tried to maximize every opportunity, whether it was trying to see surgeries, whether it was trying to follow the physicians, because I think sometimes as a physical therapist, you want to have that good holistic care team when you're treating patients. And so being able to hear what physicians are telling, athletes and patients is so valuable, because then you have that knowledge when they're asking you those questions. You can say, oh, well, I know what exactly they're telling them, and I can be, on the same wavelength. And so, and any like extra services that clinics would provide. So like if aquatic therapy was there, if they had dry needling, if they had, A-stem is kind of like a lot of times they'll have Graston tools and things that you can use, but anything that was offered, I just wanted to be a sponge and absorb every ounce of it. And then as far as kind of the job interview aspect, just, you want to you want to be yourself, and you just want to do the best job that you can, and they understand that you're a student, you're learning, but just asking questions. I think being humble, being not, I think sometimes people get a persona of they have to know everything and they're expected to know everything, but just being able to know that like you are learning and they know that you're learning, and this is your one opportunity to really kind of take all that in.
Good. Yeah, that's awesome. So with all that work experience, you're at Children's Mercy in their wonderful facility now. Kind of what inspired you to, like you had talked about, they were kind of talking with you and you were kind of talking with them. What kind of inspired you to, really look into their facility?
Yeah, so kind of interestingly enough, when I left PTA school, I was really interested in like inpatient rehab. So I really liked kind of that aspect of physical therapy. I had always played sports in my life, but until I was really in Colorado Springs, kind of on my last clinical, I never realized that kind of that sports specialty kind of, I guess, really existed, as far as, oh, this is, I can really work with athletes, from professional, at that point I was working with professional Olympic, kind of college caliber athletes. And so then coming back, I think it was more at that time in my mind, well, I just kind of need to get in the same location. So I don't know exactly, but when the conversation started with Children's, I remember thinking it really intrigued me and I was really interested, but I also didn't really have any pediatric experience, as far as a lot of times when you think of like pediatrics and you're going through school, you learn a lot about kind of torticollis, cerebral palsy, things like conditions that are a little bit more chronic. You're not necessarily going to, sometimes fix. It's more kind of managing that care. And so one of my biggest, I think, concerns was, am I going to be able to do that? And am I going to be able to be a valuable asset to their program? But then as the discussions continued and kind of realizing that they do have kind of this sports specialty that is very unique, then that again kind of progressed those conversations. And what really I think attracts me to Children's Mercy is just the environment. When you're there, everyone is all on the team of getting, this athlete, this patient, this person, back to kind of being able to function and do the things that they want to do. And there's just such a stress on kind of that whole patient care team working together, being a team. A lot of times, in clinic, I mean, even as staff, we'll be talking back and forth about, okay, how can we best, help this patient? This is kind of where they're at. What can we do? And so I think that was one of the biggest, I think, attractions to that location.
You had kind of talked about that when you were a student, being able to ask those hundreds of thousands of questions to all the different doctors and physical therapists. With your current coworkers, you and Michael, or you and the other physical therapists, you had said that you're able to bounce ideas off of each other. How do you guys manage your clients with your time and, the relationship of being able to talk with the other doctors in your practice?
Yeah, I think they're busy days. And so, if you have kind of free moments throughout the day, you're just trying to utilize that time to ask those questions. The nice part about kind of where we're at is the doctors are kind of right over on the other side. So if we need to ask the physicians a question, or if we need to ask someone else, it's just something pretty quick. We can walk over and, if a patient might be warming up on a bike, okay, I may like sneak over to the other side to ask the doctor a question real quick. Or if the patient just saw the doctor, again, I may get them started on a warm up. Okay, now I'm going to go over and just kind of check in and see how the appointment went, just so again, everyone can kind of be on the same page. And then as far as I think, like staff to staff, so like, Michael and I and the other staff, at the Village West location, we really try to just, again, utilize that time. So in between patients, if there's kind of a challenging case, or if something's not really going according to plan, or there's, kind of those random things that pop up, we just really kind of try to ask each other in those little moments, whether it's over lunch real quick or things, just so we can try to, again, best serve the patient and best serve the athlete.
Right. So with that children's sports medicine facility, what are some of the benefits? Like a lot of people say that a PE teacher gets to just play games all day and teach lessons about how to play kickball or basketball. What are some of the benefits, that you get to see being in such a great facility like that?
Yeah, I mean, it's definitely one of a kind, especially in our area here. And so there's so much equipment. So, we have anything from your like squat racks, that you could do like squats, bench, anything that you would think in like weightlifting class that you could do is there. There's some Kaiser trees, which are kind of the, if you all aren't familiar with that, it's just kind of, you have like a band or I guess like a handle with the band, and you can put different handles on it. And so you can do different things from kind of core workouts to leg workouts. We also have other things called a power plate, which essentially has vibration that goes through it. And there's been a lot of research done on just kind of how that can enhance kind of muscle activation while doing certain exercises. People do a lot of like dynamic stretching on those too. We have our Hydro 2000 and Hydro 3500, which are our two pools inside that we utilize. And so aquatic therapy is something else that is fun to play with and kind of get in and to kind of have patients, a lot of people love getting in the water and swimming. Treadmills, anywhere from kind of your regular treadmill to kind of your Woodway treadmills, which are just a little bit different and generated by your own kind of like footsteps and force.
Right.
We also have kind of an Alter G treadmill, which is an anti-gravity treadmill. And so if you think of getting in the pool and like the buoyancy of water and that kind of unloading you, that would be essentially what kind of the Alter G, it's kind of like you're floating on the moon, you're just kind of running. And so, people that have like weight bearing restrictions, they can't put weight on something, or let's say you're having just knee pain, you can't run, things like that. Always getting in there is nice. You feel like you could run for days. And then probably the other unique thing is there's a human performance lab that's attached to the facility. So we will get people in there. You can put little markers all over your body, kind of like create a little avatar of yourself. And then, if we want to have someone pitch, if they're a baseball or softball player, or throw overhand or kick the soccer ball, or, if they need to kind of do some overhead hitting for volleyball or tennis or, whatever the sport may be, we can get them in there. We also have force plates in there. So a lot of times we'll do different jumping, with football and other athletes. And so that's a great utilization too.
Awesome. So with all that equipment, what and your patients, what does a weekly rundown, Monday through Friday kind of look like for you?
Yeah, things have changed with COVID. So it used to be a little bit, more fluent, I guess. Now we're required to have kind of breaks in between patients for just, infection control purposes and cleaning and things. But as far as kind of utilization of the equipment, it really depends on who's coming in that week and what they're being seen for. But I would say on a weekly basis, I'm definitely getting in the pool weekly. I'm getting patients in the Alter G, multiple times. I'd say the human performance lab, I would say that's probably a little bit more few and far and in between, because it just kind of depends on, are we looking at their running? Are we looking at their gait? Are we having them throw? Are they in the point when they can do like a return to throw program if they've had surgery or if they've had pain? And so that might be a little bit more, maybe, kind of every couple weeks, every 3 weeks, or, a little bit more kind of monthly. But, as far as like the power plate, I use that quite a bit. I enjoy that. I'm probably one of the therapists that use that a little bit more than others. The treadmills definitely get utilized. We use kind of the Woodways more with like sprinting, or I like to get them on and have them do sprint intervals versus kind of on the regular treadmill. But the nice thing is, and I think that's the fun thing about physical therapy, is it varies. And that's kind of like every person that you see is different. Every person has a different story. Every person has a different injury. differently. And even though you might have 5 ACLs or 5 ankle sprains, each one of them is different because they're playing a different sport. Their body may respond differently because you might have, one may be having issues of swelling, one may be just like flying through. And so that's kind of the fun part, is being able to have all of the different equipment, and you can kind of have your pick of the litter of what you kind of want to use that day to best help the patient.
Right. So you kind of touched a second on running and gait analysis. I know that is something that you're working on as one of your new specialties or certifications. With that, what do people look for when you're looking at gait analysis?
Walking or running, or both?
Brief of both, maybe.
Brief of both. Walking, you're just looking pretty much to make sure that they have a good, like, kind of heel toe gait, as far as like, you're not getting like a pirate kind of peg leg type, gait pattern, or other things that can kind of present with other injuries. When you get into running, there's a lot more that you're kind of looking at. And so again, I'm at the very beginning of the process of doing the certification, but a lot of it is you're looking at what's happening at their hips, what's happening at their core, what is their arm swing, what does their leg extension look like? So leg extension meaning kind of what does their stride look like? Are they getting a really big stride? Are they more choppy? And with different athletes, you're going to have a different stride. Your cross country runner might have a different stride than kind of your 100 meter sprinter and track. So it just kind of depends on what you're looking at. But those are probably a lot of the key things, is what's happening with arm swing, stride, step length, stance time, all of those kind of core, hips, are they dipping? Because then those can kind of lead to knee injuries. Those can indicate kind of, hip weakness, core weakness, things like that. And then those are the things we would treat in the clinic.
That's awesome. Yeah, that's pretty interesting how it varies so much different from just the walking. You don't think about your core or hips or whatever when you walk, as compared to the whole body movement of running or sprinting.
Yeah.
With the blood flow restriction and the overhead athlete specialties, what do you do with those with your student athletes?
Yeah, so I specialize in the overhead, and I love the softball athlete, obviously, because I played softball. But a lot of times the blood flow restriction, what that is designed to do is kind of fatigue the muscle out, and then it kind of isolate, the blood flow in the it would be like the lower part of the arm. So a lot of times you'll put it up as high as you can, on the arm, and then it's going to isolate that blood flow down the rest of the chain. And what you're trying to do is, a lot of times it can help with some of that residual pain. So sometimes if they're having pain kind of going down the arm, typically with kind of blood flow restrictions, there's designed reps and sets. So a lot of times you'll have them do 30 reps in the beginning, then they'll rest for 30 seconds, then you'll do 3 sets of 15. They'll rest for 30 seconds in between each of those sets, and then they'll rest for 2 minutes at the end. And so you can pretty much have them do anything. It kind of depends on where they're at in their rehab as to what you would have them do. But you could do something as simple as like a bicep curl, and have them work on that if you're wanting to kind of work on, again, bicep strength, or you could have them do kind of eccentric, bicep loading, from, to like maybe even ball, kind of throws against a wall, a little bit more dynamic, a little bit quicker. It just kind of depends on what you're trying to target.
So would that be something different? I know I was a college baseball player, so overhead throwing, we did a lot of, it's called, I don't know if that's the correct term, but they called it milking your arm after you threw. Is that kind of the same sort of idea as blood flow, but opposite of restriction, since you're trying to push it back towards the heart, or how does that? Probably they're going for similar benefits, but they're just doing it in different ways. And so I think the biggest thing with like the blood flow restriction is you're really trying to, if someone's having difficulty activating a muscle, you're really trying to help them get that muscle to work harder, to get it to kind of start firing, if that makes sense. Yeah.
And so I think,
kind of like those oxygen deprivation masks.
Yes, exactly. Yeah, exactly. Got it.
Cool. So we got your weekly rundown. What's something that, you may wish you would have learned in high school or maybe early on in college that would help you now with your job?
In high school, I think I would have. I wish I would have just known all of the different like avenues that there were in physical therapy, or that there were out there.
Right.
Because I think I was very undereducated just on, I don't know, what was out there and what was available, which is why I kind of went the business and then, the physical therapy route. And I was in physical therapy, unfortunately, when I was, in high school and things. So I knew that it existed, but I think just as far as all the different outlets and avenues and things that were there, I didn't know. In college, specifically probably in undergrad, I think I wish I would have known, just exact. I think I wish I would have just known more about physical therapy in general and how they help people, and just, that there's so much involved with it. It's not just like the physical recovery, but you do have kind of those emotional, spiritual, kind of mental, everything kind of aspects that go into an injury and recovery. And so I wish I would have known more about that, because I think, you are, as a PT, we do spend, we spend more time with these athletes a lot of times than the physicians do, because we're seeing them multiple times throughout the week. We're spending ample time, with them when we're at those. And so I think I just wish I would have known more about that side, because I think it's so key.
Yeah, that's awesome. So is that something that, like, sports psychology type stuff, is that something that you are looking into as some of your own professional development that you have to develop into?
Yes, actually, I was supposed to attend a course right before COVID happened, and then they just have not redone it. So unfortunately, I'm kind of waiting on that end. But yes, that's definitely kind of in my on my radar as far as what I'm trying to kind of gain some more knowledge about, because I do think it's so important. And we have some mental health, I guess, or kind of people that assist with some of that. But sometimes I think there's a difference between, do they truly need to see kind of a mental health specialist about it, or is it just kind of something that you can help kind of navigate with just kind of like the fears of going back and things like that after an injury? Because those are pretty common in almost anybody, is having just, reservations after you've had especially a big injury on, okay, if I do this, is my arm going to support me? Is my leg going to support me? Or is it just going to, go into again? Yeah, exactly. And so, so that's definitely on my radar. And I definitely have some interest. I'm kind of dabbling in some softball research stuff right now, because there's just a lack of that out there, just as far as kind of nationwide. And so, working on quite a few things.
That's cool. Yeah, I took a course at KU for my master's in sports psych, and it was really interesting to learn. Being a former college, as baseball, softball, that sort of same thing, you see some of those crazy injuries, and then people come back and they're like, oh, I don't know if I can throw, or maybe they were hitting the head with a ball or somewhere on their body and they're batting again, and you see them, kind of timid away from that. That's real interesting. What's a book that you would recommend for a high school, college student that might be getting interested in physical therapy?
Oh, a book.
It doesn't have to be PT like specific. It could just be medical something, or maybe an article that you've recently read.
Oh, that's a good one. What I would recommend maybe is, so apta.org is basically the American Physical Therapy Association, and they have tons of resources, journal articles. I mean, everything on there, from information about being a PT, from being a PTA. And so I think that would have a lot of information. The neat thing about kind of, if you go to that website, you'll see kind of within the American Physical Therapy Association, there's like 18 different like special interest groups. And so they have like a sports section, they have an orthopedic section, an aquatics and education section. And so it kind of shows like a lot of some of those different avenues and like specialties, neurology, all those different things. And then, yeah, as far as a book, I don't know. I'm not probably a huge reader of, I don't know if I should admit that, but I'm probably more, maybe looking at some journal articles or things like that instead. Get Out of Your Head is a baseball book. If anyone likes that, that's kind of a good like mental, kind of gives you some neat strategies from what we were talking about, kind of that mental aspect of things. So that's just a good book in general if people are wanting something like that to maybe help get them started. But
so with that, what's a product that you use on a daily basis that you just absolutely love having at your utilization?
This probably isn't like anything fancy, but just I mean, I use TheraBands every day. I mean, again, it's nothing fancy, but it's something easy that everyone could get a hold of. And I use that for so many different things, from arm workouts to legs. And I think sometimes, especially kind of like at children's, the population we see, specifically probably more that 12 to 20 some year old range, I think a lot of these athletes forget that sometimes simple is more. And so I think sometimes, they're all about, getting back into the weight room and lifting and doing all these things. And then unfortunately, I think sometimes we see injuries from that. And so I think TheraBands and kind of like body weight workouts and things like that for some of these athletes are so huge. And so TheraBands are huge if you have access to it. I also like using like kinesio tape and rock tape at times for things that need a little bit more kind of management. But yeah.
Right. And then who's someone that you look up to that you would definitely want to meet if you could?
Meet if I could. James Andrews is a huge, just a huge icon in kind of the sports world. He's really big in baseball. They've done tons of baseball research over the years. And so that's someone that I just has so much knowledge in regards to just baseball, where it has worked on tons of professional baseball athletes, and just I think would just be great to like sit down and I'd love to have kind of a conversation with. And not kind of PT related, but I think Charles Barkley, I would love to like have a conversation with him one day, like go play golf and like watch his crazy golf swing and just
enjoy some of those stories that he has.
Yeah, enjoy some of the stories, but yeah, those would probably be a couple.
All right. Last question is, if you don't like blank, then being a physical therapist is not for you. So an example would be like an athletic trainer. If you don't like feet, being an athletic trainer is not for you.
Okay. If you don't like how would I even describe it in a short? If you don't like, I don't know, like weird, maybe kind of like injuries. So like if someone came in and their arm was, kind of like, in a weird position, or, if someone came in and their toe looked like it just wasn't in the right place or something, then maybe, yeah.
General sports injuries.
General sports, yeah. Then, or like if watching like a basketball game, on TV, and you see someone go down and you can't watch those types of things. I don't know. It may not be the best, because occasionally you'll have that, they just come in. Yeah, that would probably be, you have to get through anatomy. So, if you can't take the smell of like, or working on kind of like a cadaver, then that might not be, because you will have to go through an anatomy course at some point in schooling.
Right. I guess I have two more questions that kind of come up in mind. If you could list maybe 2-3 keys to your success in physical therapy and becoming a doctor and going through this whole process, of how you got there, what would be 2 or 3 of your keys that you would recommend people like follow or try to do?
Passion. I have a huge passion, and not necessarily. I mean, I love physical therapy and I love my profession, but I think just a passion for life, for helping people, for wanting to kind of make a difference. And I think that's extremely important, because if you have a passion for something, regardless of what that passion is for, and people see that, they can feel the energy, they want to be a part of that, and people are willing to take a chance on you, and people are willing to kind of to help you get the skills that you need if you're lacking in certain areas to get to the point in your career where you want to be. So I think passion is really big, and then I think like I don't know, but like putting yourself in the right positions, and so in a way, maybe like positioning yourself. Again, in college and in undergrad, I was really involved, in government and ambassadors, like on our regular campus. But then as a PTA, as I mentioned before, I was extremely involved as a student, and you don't always, I think, have to hold a position like in a class or things like that, but just, trying to put yourself in a position to surround yourself by people who are going to make you better. And so, finding those mentors within the profession who can really, or who are professors or teachers or whoever that is, who can really kind of help guide you on the right track. And, life is so much about, who and timing and being in the right place. And I look back at my life, and I think a lot of things too just kind of happen to do with just kind of the people I surrounded myself with. And then, in clinicals, like I sought out those opportunities, like I knew those were places I wanted to be. So just kind of putting in the hard work, surrounding yourself with good people, and then just having passion, I think will take you really far in life and whatever you want to do.
Yeah, absolutely. And that kind of rolls right straight into my last question is share your why. Like, why did you choose physical therapy, and why is that such an important part of who you are?
Yeah, I think it came back to, as I briefly mentioned, I was in physical therapy a lot. Unfortunately, from when I was probably in 6th grade to, even like a little bit in college, and I had some roundabout issues with just kind of knee problems. And just looking back on my career, I just feel like if I would have been provided the right knowledge at times, that maybe some of those could have been prevented. And so that makes me extremely passionate about, injury prevention and kind of being proactive versus kind of reactive.
Right.
And I love people. I want people to have the best or get the most out of life. And I think sports especially has so much to offer, from just, learning to work with people, learning to be on a team, regardless of your success, your win-loss record. I think there's so much that you can gain from, from athletics and life. And I just, as a PTA, from helping someone learn how to walk again, as simple as learning how to walk again, to, being able to go back out on the soccer field or the baseball field. There's so many avenues, and I don't know, being able at the end of the day to, I think, sit back and say, I did the best job that I could to help this person be able to have the best quality of life again. Just so rewarding and so valuable, and just means a lot to me. Yeah.
Absolutely. That's like you said, that passion, having that passion is the number one key thing. And if you don't have that, then, going to work feels like work versus, having fun and playing.
Yeah. Yeah.
Well, thank you so much. I loved your talk with us today and spending your afternoon with us on this Friday. So I will appreciate it. And our students are going to love listening to everything that's going on. Once again, Dr. Nicole Hogan, Doctor of Physical Therapy at Children's Mercy Sports Medicine.
Thanks for having me.